Okay, let's dive right into this. Welcome to The Explainer. Today, we are shining a huge spotlight on a massive, honestly kind of hidden health crisis that affects millions of people every single day. We're talking about the pelvic floor. It's this absolutely crucial part of our anatomy that is deeply misunderstood and, frankly, drastically undertreated. We're going to unpack the science, look at some staggering statistics, and explore the evidence-based solutions that are finally bringing this silent epidemic out of the shadows.
Get a load of this number, 75%. According to recent incredibly comprehensive data, 75% of U.S. women between the ages of 18 and 59 have reported experiencing 2 or more pelvic health symptoms in just the past year alone. I mean, think about that. This isn't some rare condition affecting a tiny fraction of the population. We're talking about an overwhelming majority here.
Which brings us to a really massive underlying question. Why on earth are we treating life-disrupting pain and leaks as normal? Because as a society, we've mistakenly normalized these totally debilitating symptoms. We laugh off peeing a little when we sneeze, or we quietly accept painful sex or chronic constipation is just a standard part of aging, or just part of having a body. But listen, common definitely does not mean normal.
To really understand why this matters, let's look at the anatomy for a second. The pelvic floor, it isn't just this passive hammock down there. It's a highly dynamic core responsible for what we call the 5 S's. First, it provides support for your organs, like the bladder, uterus, or prostate. Next, it gives you sphincter control. Yeah, that's control over your bowel and bladder. It's absolutely essential for sexual function. It provides stability for your entire pelvis and spine. And finally, it acts like a sump pump for blood and lymphatic fluid return. It literally works right in sync with your respiratory diaphragm every single time you take a breath.
So the crucial point here is this next staggering statistic. 96%. Out of the millions of women experiencing these life-disrupting pelvic symptoms, 96% lack a formal medical diagnosis. That means they are walking around day in and day out with a physical dysfunction that is essentially invisible to the standard medical system.
And when we talk about these symptoms, we aren't just talking about one specific isolated issue. The breadth of the problem is just massive. We're looking at things like bladder and bowel leaks, painful sex, the inability to orgasm, chronic pelvic pain, pelvic organ prolapse, and even functional constipation. Look, if you're listening to this and recognizing your own struggles right now, please know you are absolutely not alone and your symptoms are entirely valid.
Moving on to Section 1, the postpartum care gap. To really see the cracks in the system, let's contrast the highly fragmented American postpartum model with the proactive standard of care they have over in France. So in the US, the standard of care is basically entirely reactive. You did a basic 6-week checkup, and shockingly, 1 in 4 women return to work in just 10 days. 10 days! Now, contrast that with the French model. It's incredibly proactive. Every single mother is automatically referred for 10 state-funded pelvic floor physical therapy sessions starting right at 6 weeks postpartum. They actually treat childbirth like the major musculoskeletal event it truly is.
Meanwhile, back in the US, the harsh reality is that parents are often just left to fend for themselves. The emotional and physical toll here is unbelievably heavy. The data shows that 86% of US women receive absolutely no guidance on how to heal their pelvic floor after childbirth. None. We basically expect their bodies to just magically snap back without any rehabilitation whatsoever. And because of that total lack of guidance, we end up with this pretty grim reality. Only 8%. Think about that. Despite the immense physical trauma of childbirth, only 8% of U.S. women who had a baby in the past year actually saw a pelvic floor physical therapist to aid in their recovery.
Which brings us to Section 2, not just for mothers.
Now, this data might actually surprise you a bit. When we compare symptom prevalence across younger and older generations, we see an undeniable crisis. Take millennial women, for example. 50% report bladder leaks and 43% report an inability to orgasm. Compare that to Gen X women, where 61% report bladder leaks, but a much lower 24% report an inability to orgasm. So why are younger women struggling so much with this? Well, it's driven by decades of high-impact exercise, chronic coughs, constipation, and just this cumulative intra-abdominal pressure that literally wears down the tissues long before aging even factors into the equation.
And this brilliantly illustrates how expansive this field really is. Pelvic health is truly, completely inclusive. For men, pelvic physical therapy is actually a first-line treatment for erectile dysfunction, premature ejaculation, and post-prostatectomy recovery. Over in pediatrics, PT treats functional constipation and bedwetting with a staggering 92.3% success rate. That's way higher than standard medical care alone. And for transgender individuals, it provides vital prehabilitation and rehabilitation for gender-affirming surgeries, ensuring optimal healing and long-term function.
Let's transition into Section 3, inside the PT toolkit.
So how do they actually fix these issues? Well, first, we have to clear up the absolute biggest myth in pelvic health. Kegels are not a magic cure-all. Actually, scratch that. They can sometimes be the exact opposite of what you need. There are two main phenotypes of dysfunction here. Low tone, or hypotonic, means there's muscle weakness and laxity. This is where strengthening, like Kegels, can actually help. But then there's high tone, or hypertonic. This means the muscles are overactive, they're tense, and they're completely unable to relax. If you prescribe standard Kegels to a high-tone patient, you can actually make their pain and symptoms so much worse.
So instead of just handing out some generic exercise sheet, physical therapists use real, evidence-based interventions. Step 1 involves internal and external manual therapy to physically release those tight muscles. Step 2 is biofeedback. This is absolutely critical because up to 50% of patients cannot correctly contract or relax these muscles using just verbal cues alone. They need visual or physical feedback to basically rebuild that brain-body connection. Step 3 uses electrical stimulation to normalize nerve activity. And finally, Step 4 focuses on changing behavior and posture to relieve the daily stress placed on the pelvis. I want to pause and just slow down for a moment here, because this next aspect of care is profoundly important. The pelvis is deeply, deeply tied to our sense of safety and our bodily boundaries. Given that over half of women and nearly 1 in 3 men have experienced some form of sexual violence in their lifetimes, physical therapists are highly trained to utilize trauma-informed care. This means they prioritize ongoing consent, your physical and emotional safety, and your empowerment above all else. You are always allowed to pause or just stop an exam at any time, no questions asked.
All right, Section 4, breaking down barriers. Because if this care is so effective, so respectful, and so incredibly necessary, why are so few people actually getting it?
Now, what's really interesting about this data is actually what's missing. When you look at the top barriers to care, you probably expect to see cost or maybe lack of transportation right at the top. But actually, the number one barrier at 33% is that people simply aren't sure what is or isn't normal. 32% lack the time or energy, which makes total sense for exhausted new parents, and 30% don't even know that anything can help them in the first place. The main roadblocks here are medical misinformation and just pure exhaustion.
But the good news is we are actively changing the system to break down these barriers. Employers are really stepping up by expanding digital health benefits that actually cover pelvic care. Innovators are training hospital OBGYNs and nurses to evaluate patients before they're even discharged after giving birth. Clinics are creating customized referral kits so primary care doctors know exactly when to send a patient straight to PT. And the consumer market is just exploding with at-home biofeedback devices that make this care more accessible than ever before.
I want to leave you with this final, maybe slightly provocative thought. Are you normalizing the abnormal? If you are living with pain, leaks, or discomfort, it is time to stop suffering in silence. You absolutely do not have to accept these life-disrupting symptoms as just the way things are. It's time to demand better for our bodies and seek out the evidence-based care that you truly deserve. Thanks so much for joining me on this explainer, and hey, here's to a future where our health isn't just a hidden secret.